So
Good back.
much.
Okay.
Sorry about that. Thank you so much for having me. It's truly an honor to be here with all my co-panelists. Today I'm going to be talking about how to use YouTube effectively in medical practice. My name is Austin Chiang. I have several different roles. I'm the Chief Medical Officer for the gastrointestinal business for Medtronic worldwide. I'm also an assistant professor of medicine for GI at Jefferson Health in Philadelphia here in the US. I also lead the endoscopic bariatric program here. I also have another role of chief medical social media officer for our 18 hospital system. And I'm the founding president of the Association for Healthcare Social Media, which I'll get into in a little bit. So my disclosures aside from Medtronic, I'm also on the YouTube Health Advisory Board, which is very relevant to this talk. I know we heard a lot about social media already. I'll give a little bit more of my perspective as well, my motivation and journey, and some pros and cons of using YouTube. I think some of it was already covered as well. The latest numbers this year, from January of this year, we see there are more and more people still getting on social media. So there's still a lot of opportunity to get online and spread your message on there. If we look at the middle clock here, we see that on average, people spend over 2 hours on social media. And year after year, it's about the same. So this is about the limit of how much time people spend on social media each day, but it varies by platform. And we'll get into that in a little bit. Sorry, this slide is a little bit blurry, but the number one reason why people use social media these days is to stay up to date with news and current events. So it's no longer just, connecting with friends or people that you know, but it's also using it as a resource for staying current and learning and educating oneself about the news. If we look at the number of people using social media for work activities, it's pretty significant these days. Worldwide, you look at the white bar here, it's about 22.9%. I also highlighted Egypt here. It's not too far off, around 20% as well. So it's pretty interesting that people are using social media for work purposes and not just for fun or pleasure anymore. So how it unfolded for me in the early 2010s, I've always been interested in social media, had a desire to learn how medical information reaches patients because I noticed that patients were getting a lot of their information outside of their visits with me. I started doing research in social media. I obtained my master's in public health. In the middle of the decade, I started helping out our professional societies here in the US. Was appointed this role in social media for our institution, our health system, and also founded the Association for Healthcare Social Media to help health professionals use social media towards the end of the decade. And this entire time I've been active on the various social media platforms. What I discovered through my process is that wrong information is very easily perpetuated on social media. So we really need to be on there on the different platforms to be heard and to really give our perspective. Otherwise, other people will be telling our side of the story for us. So it's best that it comes from us because this is what we're trained to do. We also need more incentives to participate in public dialogue to impact public health, but that's a more long-term goal. But I think one of the key things is that at least here in the US, communication and marketing and public relations is not taught in medical school enough. And now, I'm glad that we're having the opportunity here to share our experience because we've had to learn ourselves how to do this. And we also need more guidance on how to responsibly and effectively use social media. So this is not just, in the future, hopefully it's not just telling you to go use it, but also, there's more guidance and we see more publications and the societies being more involved in educating, members in how to use social media. And this is really important because trust in healthcare, at least here in the US, is very low. So I think we want to help restore that trust in some ways by being more present and connecting with people on social media. So I'm an active user of all the different social media platforms, and I've gained a following on a lot of the different platforms. And I really show this to show that if you even just look at the different platforms here, there's a different approach that I use for every single platform. How I use Twitter or LinkedIn is very different from how I use TikTok or YouTube. And that's because I speak to a different audience on these different platforms. And I'll get into this in a little bit, but there's a way that you have to craft your image on each platform to communicate with the audience that you're trying to reach. So why YouTube? If I had to make an argument for YouTube, Keith also had a similar slide talking about, you know, the different purposes for each platform. So when I talk about the best platform to use, each platform serves a different purpose. It serves a different audience, but you also have to think about what you are good at doing. Are you good at talking to people through text? Do you like photography? Are you good on camera? I think that's a really important key point when it comes to things like YouTube or TikTok. You have to be comfortable being on camera if you're going to use it as your main platform. And really, YouTube, I think, is more suited for education, but also creative expression, but you're really talking to the general public and patients. Keith had a slide up that said that, you know, it wasn't really as suitable to have to network and to talk to colleagues, and that I totally agree with that. So, you know, it really depends on what your purpose is on social media and YouTube. You know, if your purpose is speaking more to the general public, that might be the platform for you. Of the world's most used social media platforms, you know, as everyone mentioned already, in Egypt, it sounds like Facebook is #1, and that's true worldwide. YouTube is actually #2 in terms of number of users. And if we look at the amount of time that people spend on the social media platforms, this is at least for Android users, so not necessarily for other platforms or operating systems, but for Android users, the #1 platform is YouTube, and people spend a lot of time on YouTube each month. Similarly, if we think about its reach, YouTube has a lot of users and you can potentially reach billions of people. And year after year, if you look at the right of the slide, there's a lot of people who continue to join on YouTube and potentially can be your audience. So if you think about, at least for me, when I use YouTube, if I'm looking up how to do something, I go straight to YouTube and I search how to, you know, do whatever. And so that's become my way of searching as well. And a lot of people consider YouTube to be the second biggest search engine after Google, which is kind of tricky because Google as a parent company owns YouTube as well. Here in the United States, actually, YouTube is the most popular platform right now. And if we look at this slide, this graphic on the right here, it actually is used by the greatest percentage of people across different age groups. So even older generations above age 65, 49% of people use YouTube. Among younger populations, 18 to 29, 95% are on YouTube. So a good portion of the population is on YouTube. And no matter how you break it down by gender, by race, by income or education level, here in the United States, YouTube is the #1 platform that people are on. All right, so if I dive deeper, so YouTube is mainly based on long form video. And by long form, I mean anywhere from 5 minutes up to an hour long, 2 hours long. You'll find videos that are very long. The goal of YouTube, and again, this is something Keith mentioned at the very beginning, is that all these social media platforms are based on algorithms. The goal of social media or these companies, these social media companies, is to keep you on their platform. So, and so the longer that you can keep somebody watching your video, the more they will try to get other people to watch that video as well. So if people are interested enough to watch your 10-minute video, they're going to push that 10-minute video out to other people to see. So it's a very challenging task trying to, you know, engage the viewer for that amount of time. So it really involves a lot of planning and storytelling and sometimes writing out a script for your video. There are also ways to organize your videos on YouTube. You can form playlists if you want to organize your content into different topics, which can be very helpful, especially when you're educating in GI. There is something that is more like a community like Instagram or Twitter. It's not as widely used, but they do have a function like that. Nowadays, in the past year or two, they also rolled out YouTube Shorts, which is basically like TikTok. So TikTok has been a very successful platform. Every other platform has also tried to do the same exact thing, whether it's Instagram Reels or YouTube Shorts. So YouTube Shorts, they're really trying to build another part of the platform that acts a little bit like TikTok. So these are very short form videos that are more like, you know, the first video I have here is 9 seconds long. Some others are 30 seconds long. And, you know, people have a short attention span. So sometimes this might be a better way to express yourself. So my process usually is, you know, YouTube videos are a little more time consuming to make. There's planning involved, there's filming involved, then there's editing, and then there's how do you package it? You have to, you know, create the graphic that makes people want to click onto that video. And this graphic is called a thumbnail. So there's a lot of work that goes into this. So just to summarize really quickly, some of the benefits of YouTube is the searchability. You can actually search for a topic and search for a video. You can't really do that on a lot of other platforms, whether it's Twitter or Instagram. You know, it's much harder to search for something. Google, because it owns YouTube, is a big reason why YouTube is very powerful. When you search something on Google, a lot of the results that pop up here on the right are YouTube results. And that's really important because it all has to do with search engine optimization. For younger generations, for the teenagers, it actually is the #1 platform. And YouTube is very powerful because you can leverage that Google search function to engage in paid advertisements. If you want to advertise, you can you know, spend money and have your content pushed out to certain people. You can also earn money from YouTube. You can monetize your platform. So the number of views that you get on YouTube, that can translate to money that you can earn. And YouTube Health, of all the different social media platforms that I've worked with, and I work very closely with all of them, they are very, very devoted to building out their health portion of their platform. And they're working on how to combat misinformation better and how to make sure that people are getting good information. So I think that, you know, all of these platforms are late to try to work with health professionals, but they are very invested in this space. Some of the challenges of YouTube, however, is that there's a lot of misinformation. And this is one of the studies that I recently presented. We looked at the most popular videos about colonoscopy on YouTube, and there is a lot of misinformation. It's very sad, actually. So I think it goes to show that we need to be on YouTube and other platforms, again, to really try to talk about what the facts are when it comes to GI and gut health. There's a very high barrier to entry because it's very complicated and takes a lot of time scripting and filming and doing all these things. So it takes a lot of practice if you want to make a good video. Sometimes you can hire people to help you out too. There's inconsistent return on investment. You might put hours and hours into a video and you might only get very few views. So sometimes it feels like you're putting in a lot of work and getting very little out of it. It's also very challenging when it comes to patient privacy and monitoring. You know, if you're going to talk about cool cases and, you know, your job, you have to be very careful about how you approach the patient's privacy. And if people are commenting on your video and saying things that are inaccurate or they have complaints, you have to monitor that, and that can be very tricky. And to the point earlier that I made, there's less networking. It's not really a platform for you to connect with colleagues and to work on research projects together. So it's really aimed at the public and not at the professional community. And so that's it. Hopefully that was helpful, and I'd be happy to answer any questions that you might have. Thank you again for having me.